Hi, now let's discuss about the functions of biological materials involved in open heart surgery and some of the medical devices related to artificial hearts and drug-eluting stents. So this picture shows a cardiopulmonary bypass during the coronary artery bypass surgery. So this picture shows a patient which is undergoing open heart surgery due to the coronary artery vascular disease. And you can see the patient left leg is exposed because to harvest the saphenous vein, which will be used for this bypass a conduit, so naturally occurring, naturally present bypass. And also on the right top side, you can see these are a heart-lung machine because this surgery involved the heart to stop and you need to do this anastomosis. So putting together this saphenous vein as a bypass graft to connect to that part of before the narrowed downstream of the narrowed coronary artery to the aorta. And during the time, the patient's heart and lung function is now taken by this cardiopulmonary bypass. So that's an open heart surgery. This is a major surgery because we have to open the chest and open the rib cage. And so why do we do this? So that's for, you already have seen this, the same one. And heart-lung machine, there's a perfusionist operating a heart-lung machine. And these are the statistics. And while it's also compared with the other one, so CPB stands for cardiopulmonary bypass. And there's another technique which came later, which is off-pump coronary artery bypass, which stands for OPCAB. And you can see total cardiopulmonary bypass is decreasing, while off pump, without using external pump to do the coronary artery bypass is increasing. So during the surgery, the patient chest is open to full expose for the heart for operation. So we do need open heart surgery when we need the total heart transplantation, or so-called CABG, coronary artery bypass graft, or replacing heart valve. You need to fully open the chest and open heart surgery. So this is quite common from even in the middle of 20th centuries to up to date for the surgeons to take care of this. So let's get into see a little more closer into this cardiopulmonary bypass, which requires a heart-lung machine. So what is this CPB? And you can see during the surgery of the heart, you need to take the function of the heart and accompanying a pulmonary function by use of this extracorporeal circulation, which is, you see the inferior vena cava and superior vena cava. So those venous blood gets into the venous reservoir, and then you have this oxygenator. You need a pump to give a pressure to eventually to aorta so that it can push the oxygenated blood into circulation. So this cardiopulmonary bypass is a technique that a form of extracorporeal, which means outside of the body's circulation, that temporarily takes over the function of the heart and the lung during our surgery. So this cardiopulmonary bypass is commonly used in especially coronary bypass heart surgery or coronary bypass heart bypass coronary artery bypass graft. This is because it's so difficult to operate on the keep beating heart. So you have a method to slow down the heartbeat so that you can do operation. So here shows the heart-lung machines. So you have a heart and the blood from central veins and coronary suction. This pump makes the venous reservoir, and then you basically have an oxygenator to give the partial pressure of oxygen high and then control the CO2, and using the pump to give back to the aorta. So treated blood return to a patient. However, this technique, as you can imagine from our knowledge of biomaterial, you stop the heart. That means some of the blood in the heart may not be flowing. That can poses a risk of blood clotting. Also, these external surface, which is an external biomaterial, in contact with the blood, raises a risk of a blood clot. So you can see there are some risks involved with this coronary cardiopulmonary bypass surgery. So this is called as a coronary artery bypass graft, so or simply CABG. So my friend, he said his daddy has undergone this CABG surgery, and when opens up, the doctor found 6 places of needs a bypass. So his daddy undergo a 6 coronary bypass graft. So let's take a look for example. So there could be a single left coronary artery. Then you can have this downstream to the aorta somewhere here. And if there's a double, in this case, left coronary and right coronary, so you can have a bypass of these 2. There's a triple one, even quadruple one. You can see this a number of multiple bypass graft. So CABG is a surgical procedure to restore normal blood flow to an obstructed coronary artery this is caused by arteriosclerosis or atherosclerosis. So this CABG is usually performed with the heart stopped, so necessitating the use of cardiopulmonary bypass. This we call on pump. Okay, so but the problem is this heart is stopped, and there's a risk to patients and complexity to the operation, and because of this, there is a potential for release of fatty debris to form blockage or lining on the arterial wall may break during this CABG procedure, especially you have to connect to this aortic wall, and that results in traveling clot, which is emboli. That can, if they go to the brain, they can cause a neurological damage from stroke. So there's a higher risk of stroke and memory issues for the patient who undergo this open heart CABG surgery. So there's another Japanese doctors developed another ways of like beating heart, leave it the beating heart while this is difficult to do surgery, but you can have a suction and grab the heart with the suction, and that part of the surgery is temporarily, at least not while the heart is beating, that surface can be stationary so that you can do the surgery. This is technically more challenging. However, the merit is you don't have to stop the heart. So, so you don't need this cardiopulmonary bypass. So that's called off-pump coronary artery bypass or beating heart surgery simply. This is a form of also CABG surgery performed just without cardiopulmonary bypass or heart-lung machine as a treatment for coronary artery heart disease. So we can see the advantage of this is, so if you look at this, it's still open heart surgery, and there's this device called a stabilization device with these a suction cup to just attach to the heart, the part of the coronary artery to be treated, and then you suck and then grab the heart in that part so that the blocked coronary artery, you can have this bypass graft. Of course, this is technically more challenging. However, because we don't use a cardiopulmonary bypass or heart-lung machine, the reductions of that debris or a clot will become an advantage. So let's look at a little more closer that this stabilization device have a suction cup. You see this air basically suck the heart because the heart surface on that part is grab this and stabilize. And during time you can use bypass graft with the downstream of the stenosis of the anterior descending of coronary artery. So that bypass graft goes to this aorta. And so the big advantage potential is a reduction in stroke. So that could be very, very beneficial.